Given that Australia has one of the highest incidences of skin cancer worldwide, each and every Australian should be conscious of any changes to their skin. As you are undoubtedly aware, treatment options for skin cancer improve with early diagnosis. Because of this, it's critical to understand the warning symptoms of skin cancer so that you can examine your own skin with confidence. What is your level of familiarity with skin cancer symptoms? We'll examine the warning indicators on your skin that you should be aware of in this video. So, let's begin. 1. Changes in the appearance of a mole. Normal moles rarely change in appearance on their own, and any changes could indicate the presence of cancer cells. Signs to look out for include changes in color, size, shape, texture, or symmetry in existing moles. You should also take note of any itching, tingling, pain, or discomfort you may experience in an existing mole. 2. New moles. New moles can appear later in life, and though usually benign, are more likely to be skin cancers. Of particular concern is any new mole that doesn't look like your existing moles. If you notice a new mole, especially if you're over 25, it's always worth having it checked, even if it's just to provide peace of mind. Remember, in the case of melanoma, it doesn't necessarily appear in a body area exposed to the sun, with melanomas being known to appear between toes, under armpits, and in the genital area. 3. Itchiness, pain, or oozing moles are typically painless to the touch and won't even be noticed during day-to-day activities. Normal skin irritation can happen to anyone, but moles or marks that are constantly itching need to be checked, especially if it is accompanied by any oozing or any other signs on this list. If you're also experiencing pain or itching in the surrounding skin, this could also indicate something isn't quite right. 4. The surface of the mole becomes scaly, rough, or ulcerated. Moles are usually smooth to the touch, if they're even noticeable by touch at all. By scaly, we mean any scab-like rough texture, wound-like features, any flakiness, or any type of inflammation or unusual texture, especially if this texture is a new development and has a reddish or brown color. 5. A sore or spot that won't heal or go away. Sores can happen for several reasons, but any open sore that doesn't heal is worth having looked at by a professional, particularly if it is on skin exposed to the sun or anywhere you've had blistering sunburns. If the sore doesn't heal, bleeds, is growing, or is rough to the touch, it could be a sign of squamous cell carcinoma or basal cell carcinoma. 6. Suspicious spots. When people develop skin cancer, suspicious spots, whether they're unusual moles, bumps, or marks, are telltale signs. Most times, new spots will turn out to be something harmless, like an age spot or a skin tag, but it's better to have them checked and be safe rather than sorry. 7. Any quickly growing or developing mass, mole, or lump. Malignant tumors or cancers evolve and change over time. So if any mole, lump, or mark on your skin changes, you need to have it examined. This is true even of an area you've already had examined and cleared. Depending on the type of skin cancer, it can evolve rapidly. So make sure to book an appointment as soon as you notice a change.